It is hard to fully appreciate the raw cynicism behind the creation of much of America's sprawling entitlement system. From the New Deal to the Great Society and on to today's Patient Protection and Affordable Care Act, Democratic presidents have used social welfare and the transfer of wealth to attempt to forge a permanent Democratic majority under which the interests of the state would be made identical to the interests of the Democratic Party, and state dependents made, in effect, dependents of the Democratic Party. But the true champion of this system of dependency was Lyndon Johnson. Unlike FDR's New Deal programs enacted in a time of unprecedented decline in U.S. economic output, Lyndon Johnson's Great Society programs were not enacted in response to an emergency of any kind, much less one so deep and broad as the Great Depression. When Medicare was adopted, the elderly were the single wealthiest group of Americans as they are today. The first Job Corps office opened when the unemployment rate was under 5%. The poverty rate had been declining steeply for years before the War on Poverty began to be implemented in earnest, falling from nearly 19% in 1959 to less than 10% in 1968. After the first skirmishes in the War on Poverty, the rate began to climb. War was declared and poverty won. Now, clearly the Great Society was built for some other purpose than to help those whom Johnson purported to help. Now, it was built to help Johnson by transforming America from a nation of independence to one of government dependence. Before the Great Society, the share of household income derived from federal payments was vanishingly small. By 2009, 48.5% of U.S. households were receiving direct entitlement payments. Before the Great Society, less than 8% of household income came from federal payments. Today, it's nearly 18%. And as late as 1979, the majority of federal transfer payments went to the poor. Today, 64% goes to the middle and upper classes. And if Obamacare stands, fewer than 25,000 households out of a country of more than 300 million people will not be eligible for government subsidies. Nope, we're all welfare queens now, or at least we soon will be. And we have a great deal of evidence that massive federal entitlement programs, whatever their motives, do not work. Health outcomes for Medicaid patients are in fact worse than for those who have no health insurance at all. Medicare and Social Security have not reduced poverty among seniors. Head Start, TANF, AFDC, and the like have not reduced poverty among children. These programs are fiscal nightmares, to be sure. Our current unfunded liabilities under Social Security and Medicare amount to more than all the money in the world, literally more than every bill and coin in every currency around the world. But the fiscal nightmare, while terrifying, is not as terrifying as the moral nightmare behind it, because millions of Americans are being exploited for the benefit of the permanent political class. In the name of a war on poverty, we have needlessly impoverished many millions of Americans. We've needlessly ruined many millions of lives. The dependency agenda must be reversed and the federal welfare state dissolved, not only because we can't afford it, but because failing to do so ensures that our politics will remain warped by perverse incentives, by unconstitutional seizures of power, and by what amounts to the looting of the fisc by the parasitic political class. That is what is at stake, not merely the national balance sheet. And to read more on this topic, please purchase our broadside, The Dependency Agenda, by Kevin D. Williamson at www.encounterbooks.com.